Hello, welcome everybody. My name's Rianne and I'm going to just do this short presentation for you, just outlining kind of herbal alternatives to HRT, because in my role as a herbalist I get lots of ladies that can't take HRT or choose not to. So this is a really great opportunity to look at, what alternatives are available to ladies that choose not to go down that path. The first kind of thing to say is that there is no one size fits all. So lots of people want to have the kind of magic bullet, and as we age as ladies and our hormones start to go a bit all over the place, then we want to find that magic bullet that, will fix everything for us. But actually it doesn't really exist. It's painful to hear, but actually it's true. So when we look at HRT and we look at herbal HRT, there is no one protocol that suits everybody. So actually, in lots of ways, HRT can be challenging for lots of ladies. It doesn't kind of fix everything, and neither does herbs. But what we're trying to say is that every person presents differently with their symptoms, and therefore there is an individual protocol available for everybody. So it's about matching the symptoms to the person. That's the kind of first thing. The second thing that I want you to really understand is just about herbal medicine, because lots of people don't really understand it. They kind of think it's what you buy in Holland and Barrett. Lots of love to Holland and Barrett, but there's a real disparity between how you can actually take herbs. So think about what's the difference between a herb and a food, right? That's the first thing. Well, actually, there is no difference, but the dosage and the strength of that herb becomes a medicine when we change it by adding certain components to it. So when you have something that you have in a food form, like ginger or turmeric is a classic example. If as females going through menopause and we have kind of hip pain from running, when you have turmeric in a stir fry or turmeric in a juice, it's great. Okay, no, maybe good is the best analogy. But when you start to get consistent hip pain, then you need to increase the therapeutic dosage and kind of turn it into a medicine. So the best example that I can give you is here I've got kind of a herbal product, which is dried herbs, you see. So you would make a tea out of that, so an infusion. That's good, okay? So for treating something menopausally, then that's a really good example by having a really good quality tea. But then we move into the category of going, actually, it's not reducing the symptoms completely, so we need to up the ante a little bit. So if we move from good to great, then we can think about capsules or powders. Then that's a great way to get turmeric in a little bit stronger. But then when we've got to a situation where those symptoms are not going away at all, then we move into the kind of amazing category where we've turned that turmeric herb into a medicine by adding alcohol. Now, these alcoholic tinctures are not necessarily available in the public domain because they're too strong. Because if Granny went and pulled it off the shelf at a kind of regular store, it might cause interactions and side effects. So when you're looking at treating really acute symptoms, not only just of menopause, but of hip pain, joint pain, anxiety, then you need to move to kind of a more of a therapeutic dosage from a kind of menopausal point of view. So that's the kind of best thing to understand, because everyone thinks herbs are just what you can go and pull off the shelf at your regular store, but actually they're not available to you in pharmaceutical grade dosages when you're treating really acute conditions. They're just not available. So that's the kind of first thing. The second thing to understand about menopause and perimenopausal symptoms is that there is no classic symptom picture. So from all the hundreds of ladies that I've seen, everyone presents differently. So some ladies see changes in their menstrual cycle, so their periods get much heavier before their periods are due to start. We've also got kind of vasomotor symptoms, which are night sweats. So women start to perspire more at night because their thermometer is slightly out. Not all ladies get this. It doesn't mean you're in menopause or not in menopause if you're getting these symptoms or not getting them. And also kind of vaginal symptoms, so vaginal dryness and urinary tract infections. So urgency to go for a pee, pain and burning. And so how do we kind of clump all this together? Well, we can't, because there is no simple one way to kind of treat all patients that are presenting like this. So I think the first thing to kind of understand is that there's always a slightly different symptom picture. Some women start with anxiety. So anxiety and kind of cognitive issues often tend to come later. So being really forgetful, planning to do something and then you've instantly stopped. Because it's just gone out of your head. Running upstairs, can't remember what you've gone up for. I'm kind of the first person to do that. And also kind of more serious psychological symptoms. So depression, anxiety, low mood, feeling like you've kind of lost your purpose. So these are the sort of things that we look for and we treat kind of clinically from a herbal point of view. Now, if we're looking at health from a naturopathic point of view, we would go, hang on, the body can heal itself given the right tools. So if we give the body the right tools in order for it to heal, essentially, then we arrive at menopause in a better place if we have all those facilities to aid the body to self-heal. That's the first thing. And if you think about, kind of two sides of the same coin, if you think about a menopausal woman, there are a lot of similar symptoms to a teenager that's going through puberty, apart from the fact that they're a complete pain in the arse and we're not, right? But a lot of the time, a teenager going through puberty, their emotions are a bit all over the place, rational thinking isn't always there, and kind of inconsistency and low mood. So from my point of view, is it appropriate to always medicate that teenager? No, it isn't. And menopause is a normal phase of life, but to some degree it needs managing. And if we can do that in a more natural way without side effects, then that would always be my kind of preference. But before we start talking about the herbs and understanding, is that when many women go into menopause, they come into a place where they're really depleted. And so from what I see from clinic, lots of women that are really depleted from a vitamin, mineral, kind of nutrient, high stress kind of lifestyle, they don't do so well entering that kind of phase of life. So for the first thing, for ladies that are listening in that haven't entered that phase yet, or if you're a practitioner, then we really need to look at deficiency and life load, because you're kind of robbing Peter to pay Paul in a way, whereby if you're really depleted in a lot of your nutrients and your adrenals are really struggling, then you don't have the extra reserve to cope with the declining levels of the hormones. So that would be the kind of first thing, is look at the life load, look at the kind of radiation exposure, so mobile phone exposure, electromagnetic radiation, and also depletion and kind of life load. Like cortisol has a huge impact on kind of menopausal symptoms and how well as women we go through it. Now, I'd urge you to have a look at the kind of the 7 dwarves of menopause, because I always kind of get a bit of a laugh about this with my ladies, that which one are you, which dwarf are you as you're entering this phase of life. We've got itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho, which is my favourite one at the end. So we've got a myriad of symptoms there that actually, how can that possibly be fixed with one product? It just can't. And so in my experience, it really is about extrapolating what's the kind of dominant symptom that's presenting for you menopausally, and in fact, how are you going to treat that? Are you going to treat all of them when they're not necessarily presenting with all those symptoms, or are you going to treat just what's important? So I think the first thing to watch is kind of menstrual changes, looking at kind of lighter menstrual bleeds or very heavy. And often women can end up with undiagnosed fibroids or just super heavy periods that are flooding. So that's the kind of first thing to watch out for. But mostly, before we look at the herbs, is think about mood disorders. So before many women kind of move into that menopausal phase, actually there's a lot of mood disturbance. So actually what we see is that women are feeling really flat and unusually anxious over situations that don't necessarily need that degree of anxiety. So early waking with anxious thoughts is one of the most kind of common symptom pictures that I see from a menopausal point of view, and that's actually easily remedied with herbs. So early waking and just inappropriate anxiety that's unusual for you. So a lot of the time what we're looking for is what's normal for you and deviation from that normal parameter, which is what you're kind of not used to. The other thing which is a kind of common feature is urinary symptoms. So urinary urgency, not being able to wait to go to the loo, it feels relatively urgent. And also infection is, kind of super common. So they're the things that we would kind of want to look out for. Now, we've got a kind of group of herbs that are called phytoestrogens. Now, phytoestrogens are herbs that kind of mimic estrogen. And you might say, well, is it safe to take, herbs that mimic estrogen? Well, actually, that's similar to what HRT is doing. So what these phytoestrogenic herbs do is that they without kind of wanting to get too scientific, is that they occupy the binding site for estrogen. And what that means is that they can mimic your body's perception of estrogen. So if you have a high dominant state of estrogen, it can help to bring it down because it's got taking the seat that estrogen would sit in. Or if you're very low in estrogen, it can mimic that depletion and the symptoms that go along with depletion. So this group of phytoestrogens are super, super important when it comes to menopause. And I can hand on heart say that I've helped hundreds of ladies with these kind of symptoms by using these phytoestrogenic herbs. So the first herb that we're going to talk about is asparagus, which you might know as shatavari. So shatavari is, in Sanskrit, we know that herb to be she with 1,000 husbands, which quite frankly, I can't think of anything worse, but let's not go there. So, shatavari is about, having that desire and having that libido that's appropriate for your age, but also just having the energy to fulfill your day-to-day duties. Because what we see a lot with menopausal ladies is kind of loss of function. In other words, just don't have the mojo to do anything. So as well as being a kind of aphrodisiac, so it's good for libido, it's also good as a reproductive tonic. So it's helpful for those levels of estrogen that are declining or fluctuating, because actually it's not as simple as saying that estrogen is declining. Often it's kind of doing this all the way through the cycle and it's difficult to catch it. So if you're suffering with painful and heavy periods in that period before they stop, menorrhagia, which is very heavy, painful periods, or just irregularity, like you're feeling like having a period every 2 weeks and then it will disappear again, then it's brilliant. And we also use it for kind of vaginal dryness, which while estrogen starts to decline, estrogen also is helpful for your secretions in the vagina, which are often more acidic in pH. So if you don't have those pH acidic secretions, you're more likely to get infection. And so infection is problematic for women menopausally. So shatavari is brilliant for that. So that's kind of the first herb that we're going to talk about. Then we've got simicifiga, which is what we know as black cohosh. Now, black cohosh is, one of the kind of the hallmarks of menopausal herbs, because it helps to regulate our hormones. So when our hormones are going a bit all over the place, then it's brilliant. We also know it's very good for, ovarian pain. So when women are getting really heavy, painful periods before they're about to stop, but also fibroids and kind of endometriosis type symptoms. So if you have an estrogen dominant state where you've got way too much estrogen in relation to your progesterone, estrogen can be coming down, but it can be coming down slower than progesterone. And so even though it's declining, you have what we call an estrogen dominant state. So simicifiga is very good at kind of balancing that. And so if you're having very heavy periods, kind of flooding, painful periods, then this is a brilliant herb for you. Also, what you've also got to think about is female athletes. So women who are very sporty, who are entering menopause, often because of declining estrogen, they end up with bone pain. So women that have run marathons successfully for years on end and, not had any problems, suddenly start to get aching hips, pain, joint pain. That can be really debilitating. So this herb would be very good for that, as well as that symptom picture of osteopenia or osteoporosis. So osteopenia is our pre-phase of osteoporosis, which is a common occurrence alongside kind of menopausal symptoms. So, I can't say enough good things about black cohosh. And actually, when you look at lots of kind of women's formulas, then they've all got black cohosh in there. But if you find that your symptoms don't clear up taking a capsule of this herb, then you need to look at increasing the dosage and look at something a bit stronger, such as a tincture. Now, another herb that we've got is Peonia lactiflora. That's often found in many formulas as well. Peonia lactiflora is another regulator for the communication between the brain and the ovary, where, the ovary is saying, hang on, I'm ready to shut down business. I don't want to kind of keep opening for business. But actually the hypothalamus is saying, come on, let's go. We've got more to do. So that disparity is what can often cause symptoms. So when we look at kind of menopausal symptoms generally, Peonia is very good at that. And it can help for women who are very stressed as well. So there's no question that stress makes menopausal symptoms much worse. And actually, adrenaline is the kind of flick switch, if you like, for women to have hot flushes. So when they start to feel that heat rising, often adrenaline has come before. Now remember that adrenaline isn't always stress. It can be dietary stressors. So think about dietary stressors. Our favourite dietary stress, of course, is caffeine. So coffee and to some degree tea can really precipitate a hot flush as well as alcohol. So if you're struggling with hot flushes, maybe you don't need a medication to fix it. Maybe you just need to reduce caffeine and reduce alcohol and kind of monitor the results. So look, I know it's boring and no one wants to hear it, but actually it can make a dramatic difference if you're really struggling with kind of these vasomotor symptoms, which are the flushing, particularly at night time. Now, Vitex Angus Castus is our kind of all-time women's herb. And, I can't say enough good things about it. And if my practice, was to close tomorrow and I could only take one herb with me, I would take Vitex Angus Castus, so chasteberry, because it's brilliant for lots of women's issues, such as, skipped periods, irregular periods, lack of ovulation, but it comes into its own when we get to menopause because it's what we call a progesterone mimic. So no, we're not giving you artificial progesterone, but we're mimicking that in the body. And so for the women whose estrogen is higher than what it should be, progesterone coming up even to some degree artificially can buffer the decline so they come down together instead of this real disparity that leads women into estrogen dominance. So Vitex Angus Castus is great also for kind of mood changes and just suddenly feeling like a psycho for no reason. So we love it and it's fairly readily available. I use it for all sorts of things. If you're going off to a desert island and you're going off with a load of girls, then you should be taking some Vitex because there'll be one lady that actually needs it. And a tutor of mine did a study on Vitex and went out to Africa to this tribe of women. And by the end of it, she got them all on Vitex and they were all menstruating together within the space of, kind of 10 days, which quite frankly is amazing, right? Get everyone menstruating together. The madness goes on together and then we can all kind of resume activity. Now, one of the other herbs that's really important is sage, which is Salvia officinalis. So Salvia officinalis is a really good herb for hot flushes and hot sweats. Now, a really great way to take it is through a tea. And if you take it through a tea, it means that there's less likelihood for heating from the alcohol. So this kind of form of herb, which is in a liquid form in alcohol, although it's brilliant, it can be quite heating. And therefore, it can, in some instances, make flushes worse. So if you're really struggling with hot flushes, then I would urge you to think about having a really good sage tea. Now, you can get sage tea from sage leaves in the garden, 2 to 3 leaves with some just boiled water. Keep it in a covered vessel, in a cup with a lid on, so that you're not losing all the goodness in the steam, and drink it once it's cooled. So 2 to 3 cups of that per day can be, you know, kind of quite groundbreaking for women that are really struggling with kind of flushes. You don't always need to move in with a tincture or anything stronger. What you have to be aware of with sage is that it's also antimicrobial. It's like what we call an astringent in herbal medicine. And so on that basis, you can use it as a throat gargle for kind of a sore throat, infection in the mouth. So it can be used for kind of lots of other things. But night sweats and kind of memory loss, then it's brilliant to have during the day for kind of those consistent hot flushes that are preventing function, because that's a lot of the thing that ladies say is that they're struggling to function. So the ideal kind of scenario, if you like, is that we put many of these herbs together in one blend, because the illusion in the kind of public arena is that you can have one herb and it will fix everything, but it's actually just not true. Like, you need a team of them. It's a bit like a football player where you need a kind of centre forward, you need a striker, a goalie, to make the kind of perfect team. Herbs are a bit the same. And so for that reason, lots of companies put all the herbs together in capsules so that you've got it all together in a blend. But if you find that many of those blends don't work, sometimes what ladies need is a 30-minute consultation on Zoom to find a blend that works for them. And you know, quite honestly, a lot of us as herbalists, we don't kind of give up until the symptoms are gone. So it isn't a one-trick formula where you can pick something up off the shelf and it will fix everybody. That's just not true, because, you know, those sort of blends are very good for standardised people. And quite frankly, I've never really met a standardised person. Met one or two in my life, but not very many. So get this idea out of your head that one product will fix everybody, because it just doesn't happen. Really, the answer is in bespoke medicine that will address your symptoms and what's led you into that state of dysfunction in the first place. So before we finish, I have to tell you about my favourite herb, which is withania, and that's ashwagandha. You might have heard ashwagandha, kind of very common herb in this kind of arena, but it's really good. It's the root that we use, and it's what we call a nervine tonic. So it's very good at nourishing the nervous system. So if you're really busy, kind of rushing around all the time, then it's a brilliant herb to bring you back into balance. Because what we fail to accept in the kind of public arena is that actually stress is one of the biggest factors that determines how women go through menopause. So if you can mitigate some of those symptoms and reduce the stress, then actually you'll get through it much better. So a lot of the time what we're administering for ladies is stress reducing techniques in the form of herbs, because you calm the cortisol and the adrenaline down, and then the hormones kind of go, then I don't need to kind of panic so much. So that's an important factor. And next week at the same time, we're going to have a look at some of the other things that will help alongside herbs, such as essential fats, such as magnesium, that will help that kind of symptom picture menopausally. So just a kind of couple of things to say that, you know, we've got herbs like withania for stress and managing kind of nervous exhaustion, because historically, you know, women stopped work when they got to menopause. They would go into the community. The other ladies would look after their kids, although their kids probably would have been grown up. They wouldn't be working. And in this day and age, that, you know, that just doesn't happen. We're all working full time. We've got kids to manage. And that can all take its toll on your stress load, if you like. So our life is very different now to what it would have been historically. So for this idea of kind of nervous exhaustion and just feeling totally overwhelmed and overloaded, then withania is a really brilliant herb to consider for that situation. So just as a kind of synopsis, we've got to think about, what are you presenting with? So one size doesn't fit all. There is no one formula that suits all ladies. And try and think about what you're presenting with and therefore what you want treated. So there isn't any women that haven't treated menopausally that don't go away feeling okay in the end. So sometimes it can take a couple of goes to get it right, but the majority of the time, ladies, when you address the symptoms that present, then menopause is just a phase of life like adolescence that, yes, is turbulent in parts, but actually can be managed in a completely acceptable and fine way. But it's just understanding whether she's depleted, whether she's stressed, you know, whether she's got enough magnesium in the system, and which herbs she might have an affinity for. So I'm going to kind of leave it there. Hopefully that's been helpful. It's a bit of a whistle stop through a really massive subject. But I'll have this as a recording for anyone that wants to watch it back. And then next week, what we're going to do is at the same time at 7 p.m. next Tuesday, that we're going to have a look at some of the other things that will support kind of ladies in menopause. So I'll bid you a good evening, everybody. Thanks for joining, and hope to see you all again next week. Thank you. I'll answer some of the questions on the chat now.